good evening, wherever you are in the world. Si Doc Joff po ito. So, I am Dr. Jonathan Flordelis, and tonight we are going to talk about the knee injuries, especially the ACL injuries. We are doing every 2 weeks ACL injuries for the young patients with knee injuries so that we can prevent knee arthritis from happening. So the young arthritis warriors natin. And after 2 weeks, we also do a live for the questions from our more senior members sa Hip and Knee Arthritis Philippines. If you are someone who is into sports, very active, you might have a knee injury, you can join the Facebook group ACL Reconstruction Community Cebu. And that's for patients in the Visayas and Mindanao area, free to join. There is also a separate group if you are in the Metro Manila area. Yun po ang ACL Reconstruction Community Philippines. And if you are someone who is more senior with arthritis already, we do have a Facebook group, the Hip and Knee Arthritis Philippines group. Free to join po. If you are hearing me, let me know where you are from. I also would like to know if you can hear my live loud and clear po. So, hoping that you guys can hear me. Message me where you are from and let me know if you can hear me loud and clear po. A lot of the times, I've been doing lives and no volume pala, no one can hear. So, if you can hear me, I would appreciate you if you are actually hearing me live po. Comment below in the type below in the comments where you are from, and please tell me if you can actually hear me. So I'd really like to know. It's 7:58. Maybe no one's up yet, but again, this is Doc Joff. You can call me Doc Joff. My name is Jonathan Flordelis, and I'm a knee specialist, hip and knee specialist at the Cebu Orthopedic Institute in Cebu City, Philippines po. Good evening, Ma'am Adeline Lucero. Please let me know po if you can hear me. So, hope you are doing well po, Ma'am Adeline. So, we're starting to answer the questions from our ACL community. We will start dito sa question number 1. So, the first question is from the ACL community. Doc, what is arthroscopy? So, arthroscopy po is simply a minimally invasive. So, if you see mga surgeries done with cameras, yan po yung arthroscopy. Doing surgeries with cameras, sometimes cameras smaller than a ball pen. So, literally, yung camera very tiny. Thank you, Ma'am Adeline, for confirming loud and clear po. So, arthroscopy is surgery in the knee or in a joint using a tiny camera smaller than this pen, sometimes yung mga instruments. And that is the new way of doing reconstruction surgeries of the ACL. We do it arthroscopically. So when a patient has an ACL tear, we do arthroscopic knee surgery using cameras. We no longer make very large incisions because before yung hiwa sa tuhod sobrang laki, it's like that. So you really open the knee. And we don't do that anymore. We now have little cameras that go inside the knee po, and it's like some people say it's like a laser. Everything is cleaned up, but we also reconstruct yung mga ACL po. So I hope that helps. The next question po, question number 2, is mag-heal ba ang ACL years after? The sad thing is it doesn't heal properly. So when the ligament doesn't heal properly, maluwag talaga siya. So it doesn't heal properly, maluwag po siya. And pag maluwag yung tuhod, you still feel it. A lot of my patients feel the looseness and instability of the knee ligaments. And when they feel that instability in their knee playing the game, you know that there's something wrong. You don't have the confidence even 5, 10 years after because the ligament is still unstable po. And that is the reason why we recommend for patients with knee injury sa ACL a physical examination. Please see a knee specialist near you so that matest po yung knee ligament nyo. We do a physical exam in the bed. We test the knee pag maluwag ba, and we can confirm if may ACL tear po ba. So I hope that helps. The next question is, Doc, may pop or locking yung knee. What is this po? So pag you hear an audible pop or locking sa knee when you are doing sports, it's very likely na ito po yung tinatawag na meniscus. So in between yung tuhod po, yung bone sa leg, and yung bone sa thigh, so in between yung thigh bone at saka yung leg bone, in between them, meron po dito yung meniscus. And if you have an issue sa meniscus, an abnormality, a tear in the meniscus, it can cause these popping or locking sensations. You can actually feel them. Sometimes it can lock, meaning you cannot bend and you cannot straighten po your knee. And it's very, very frustrating and painful sometimes for some patients na hindi ma-bend or ma-straight yung tuhod. Nakalock siya after you heal that. And they sometimes have to wiggle it around, twist it around before they can actually bend or straighten the knee. Again, these are symptoms of possible meniscus injury. You always need to be able to see a knee specialist and sometimes get tests like yung MRI tests to confirm yung mga injuries like this. Just by asking questions, hindi natin ma-confirm kasi. That's why we always have these two, examining the patient sa clinic, at saka number 2, yung MRI po. Question number 3 is, number 4, can meniscus be repaired? Really, the short answer is yes. We can repair your meniscus. Doon pumapasok yung arthroscopy, yung maliit na camera na pupunta sa tuhod niyo po. And we have special instruments para tahiin yung meniscus. Although, I have to say, it will depend on how damaged your meniscus is. When I treat yung arthritis patients na may sobrang torn na meniscus, there is less chance of repairing them compared sa medyo bata na patient na may meniscus tears. When younger patients have meniscus tears, higher likelihood that we can repair them compared to more elderly patients po. I hope that helps. Question number 5. Doc, baka maka-lead into cancer yung meniscus tear if di ma-repair. At saka maka-cancer yung ACL pag hindi ma-repair. You don't need to worry po. Not related to cancer yung ACL tears, yung meniscus tears. Very unlikely na mangyayari po yun. So, I understand a lot of our viewers, when you have injury, arthritis, or pain in the knee, we can be a little anxious, natatakot po tayo. And that is why I would like you to see a knee specialist instead of self-medicating, tapos masisira yung kidneys nyo sa mga pain relievers po. But, short answer is no. Hindi maka-cancer po yung meniscus or ACL tear. Number 6, Doc, how much mabayaran if multiple ligaments yung injury? So, if you have multiple ligaments, it really depends on which ligaments are torn because yung ACL lang, approximately siguro 200,000 in peso yung ACL na outpatient. And if there are more than one ligaments torn, ACL, PCL, then sometimes you have more implants so that also means higher cost po. But that is the general range for mga one ligament po. Pag multiple ligaments, we have to know which ligaments are torn para ma-check natin. Kasi some ligaments on the outside part of the knee like the LCL and the MCL, naghi-heal din po sila. So again, I always tell my patients, you have to consult a doctor. Hindi kasi kailangan yung MCL tsaka LCL always to be repaired. It's usually just the ACL and the PCL po. Hope that helps. Yung question number 7. Okay lang po ba pag 4 months after ma-injured, magpapa-MRI po? Of course, that is okay. This ACL injury or knee injuries are not usually emergencies. Ibig sabihin, you can have these MRIs done 4 months after. But before an MRI, please do see a knee specialist po, because you want a good physical examination face to face. And maybe if you are overthinking things, baka you may not have a ligament injury and may not need an MRI at all. So please see a doctor first. Good evening po, Ma'am Sudaria, who's this? Nak Sudaria and Ma'am Adeline Lucero. Happy to see you po. We are talking about the ACL tonight and how to prevent yung mga injuries from worsening. The question we have next. Doc, need pa ba yung MRI after an ACL reconstruction? Usually no, because after the ACL reconstruction, we can physically feel na strong na yung ligament and you just need to undergo a commitment to physical therapy and rehabilitation. Usually minimum of 6 months to 1 year so that you can go back to sports without any issues. No need for another MRI po. Unless na-re-injure nyo siguro. Knock on wood, no? So after an ACL reconstruction, hopefully you are fine. Hopefully you don't need an MRI because you did not have a new injury. Because if you have a new injury in the knee, then maybe an MRI is indicated. Again, always see a knee specialist. Always see your doctor. And don't self-medicate po. So, next question is, Doc, if without surgery, babalik pa ba sa dati yung tuhod? If it's a complete tear, it really does not give you back your confidence. The feeling na maluwag or loose po yung tuhod. The feeling of looseness in the knee, the feeling of instability will persist, as I already talked about in question number 1. So that is why we advise surgery if for complete tears po. Hope that helps and hope that answers your question. And Doc, after sa ACL surgery, mababalik pa ba ang contact sports? And what limitations can be expected? So the answer is yes, if you complete the 6 months to 1 year of physical therapy and rehabilitation after your ACL reconstruction po, pwedeng makabalik sa contact sports without limitations. That is why you need clearance from your doctor, your rehab. Pag complete yung recovery, you can definitely go back to sports without limitations. Contact sports, basketball, volleyball, and the like po. So I hope to help you with your recovery. So always, again, consult your specialist. You can always do a second opinion or third opinion po. There is no need to avoid contact sports if you actually completed your 6 months to 1 year of physical therapy. Now, question number 13 is interesting. How many percent ang failure rate of the operation? So, that's an interesting. Usually, it's less than 2%. And these are usually because of many different factors. Some of them being lack of physical therapy and malposition of the implants. It's not usually yung implant na klase. So there is a question here to follow. Is it because of the type of implant na reject ng katawan? So yeah, there are truly failures in ACL reconstructions, but it's not usually because of the implant, the rejected by the body. And if, question doc, if my failed surgery, does that mean another surgery? Well, it really depends ano yung type ng failure, ano yung cause ng failure. Usually, if you have an infection causing the failure, then it can be treated with mga antibiotics, but it's not always surgery yung anong tawag nito, always the answer. Again, as I mentioned before, you always need to consult your doctor if you've had surgery and you feel like something is wrong. Don't self-medicate, and you always have the option of getting a second or third opinion po. Hope this helps. We are going to question number 14. How long po yung rehabilitation program after sa ACL reconstruction para makabalik sa normal routine? Thank you. So, I think we answered that. It's usually minimum of 6 months before you go back to contact sports after the ACL reconstruction po. And may another question, ano po yung advantage ng titanium versus yung bioabsorbable screw po? So, it really is a patient and surgeon's choice because a lot of surgeons would prefer the bioabsorbable because it is absorbed by the body, meaning the bone is reconstituted. Magiging buto po siya. Yung disadvantage ng titanium siguro for some surgeons, some will say that they like it, it's stronger. But of course, it will not turn into bone. So, in the case na tinatanggal yung titanium, there is a hollow area na walang bone. So I hope that answers your question about the bioabsorbable screw. Very technical po. Again, number 17, bawal po ba yung contact sports after ACL? Not necessarily, as long as you finish your rehabilitation protocol of 6 months to 1 year. Pwedeng makabalik po sa contact sports, basketball, and the like. Doc, advisable po ba magpahilot? Well, I don't really advise hilot, especially if you're thinking of a knee injury. Although yan kasi yung nasanayan ng mga Pilipino, no? Before, wala tayong doktor. The hilots were the traditional doctors. It's like, until now, marami pa rin pupunta sa hilot. Pumupunta ako sa hilot because may tumutunog yung tuhod. That usually is a sign of something wrong in the knee if their knee is loose and you have sounds. So, it's better po if you see a specialist po. And the next question is, Doc, normal lang po ba yung range ng tuhod ko ngayon after surgery is 100 degrees po? Surgery was last September 28 at nag-therapy na ako ng 7 sessions po. September, October, November, that may mean po na medyo kulang yung bend nyo and you can definitely do more. If tight na po yung tuhod, we sometimes do an MUA or a manipulation under anesthesia. And again, please consult your doctor, your surgeon. This is something that you need to decide if kaya pa ba ng physical therapy or hindi. So, those are the questions for tonight. Tingnan natin. If you are someone with an ACL injury, please ask your questions sa chat below or sa comments po. Would definitely like to know if you have any questions regarding the knee injuries, ACL, and mga mga questions po. Let's see. Doc, how many weeks to do hiking after arthroscopy? Do I need crutches after the procedure? So not every patient is the same. Other patients might need crutches, most really don't. If you've seen some of the patients in the group, they are able to walk without crutches after the ACL reconstruction. That is also arthroscopy po. So they do have a brace, but not usually nagka-crutches or wheelchair after the procedure. We definitely ask patients if able to walk, we'd like them to get back walking as soon as possible po. A question from Belma Puno. Hanggang ilang phase po pala doctor kapag nag-undergo ng therapy? So, usually it's about 6 months po yung therapy after an ACL reconstruction. Yun po yung minimum. Different doctors will have different therapy durations, different protocols for their surgery rehabilitation. So I hope that helps, and it's really best if you consult your surgeon or specialist near you po para sa malaman niyo kung what protocol they are using. Is it a accelerated protocol, which is about mga 6 months, you can go back to sports, or a more traditional 1-year protocol po. So thank you for your question po. You're very welcome po, Belma Puno. Any other questions from the chat? I'm going to go through the chat groups, see what questions we have not answered. This question is from the chat from Rolf. Na-injured po ako last 2014 during intrams. Mali yung landing ng right foot ko at may ACL injury po ako. And di ako nakakalaro since. So, for patients who have an injury sa ACL, he is asking ano yung dapat gawin. Please see a specialist near you, Sir Rolf. Because if it's since 2014, you may need some procedures done if talagang ACL yung tear po. So really important that you see your knee specialist near you po. So next question. Is another question from Belma Punyo. Doc, if ever hindi matapos yung therapy sa PT, pwede naman sa bahay na lang ituloy yung 6 months. There are specific kasi na protocols para sa recovery back to sports. Yung 6 months, at least siguro, if you do therapy at home, you see your surgeon once a month para ma-check nila po kung tama yung ginagawa nyo at you are cleared to go back to your sport. Kasi for every month, what I do personally with my patients is I see them once a month for 6 months to check if they are going at the correct pace. If they are going too slow, I try to push them more. If they are not doing specific exercises or my weakness pa, because we want to build up yung patients, hindi lang muscles around the knee, but also around the back and the core and the hips po. Those are all very important para complete po yung recovery on both sides po, hindi lang yung injured side. So I hope that helps and answers your question. Salamat po. So I think yan po yung mga tanong sa chat group. Again, I have a few minutes before 8:30. If you have questions, please type them in the chat group or in the comment section. Going to answer any questions until 8:30 po. So, in the general chat, wala nang tanong. So, question about how much yung MRI. Dito po sa Cebu City area, the MRI ranges from about 10 to 12,000 for the MRI plane ng knee po. So, I hope that answers your question. Dito sa Cebu, it may be different in your province po. Kasi I know for a fact there are some cheaper MRIs around the area. Another question from Belma. Doc, ano po yung mare-recommend niyo po just in case mag-stop sa PT if babalik na sa work? Well, I really don't know your case, but it's really best if you want to go back to work, kuha kayo ng clearance from your doctor or surgeon po para ma-check yung stability ng knee mo at saka we want to know if you are not a danger to yourself or to other people when you're going back to work po. So we are at 8:22, few more minutes left. Looking at another question. Doc, na ba kay online consultation po? I'm really not keen on doing online consultations right now because to be clear, I need to do a face-to-face examination of the patient's knee injury. And this is the number one step before I request for an MRI or anything else. A good history and physical examination is really important. Even if you already have an MRI, I don't really trust the MRI 100% because it can make mistakes and I still do an examination in the clinic po. So if it's an online consultation, I'm not very keen on doing it anymore. After the pandemic, mas prefer ko po yung face-to-face examination. Hope this helps. And from Sir Choi, sa maka-apply sa charity surgery. So if you are interested in charity surgery for your ACL reconstruction, I will first again need to see you for a face-to-face examination po before I can recommend you for charity surgery. Yung process ng charity surgery involves social service evaluation and we need of course to let the resident doctors and myself see you po. Another question from Sir Belma. Doc, ilang months po pwede mag-leave kapag nag-undergo ng ACL surgery? After 3 months po ba pwede bumalik sa work? Typically, my patients go back to work around 3 weeks after surgery. They're already walking kasi day 1 after the, sometimes hours after the procedure, naglalakad na yung patients ko po. So, during day 1, day 2, uwi na yung patient. Sometimes I do outpatient ACL reconstructions. Generally, I just want the patients to rest at home and do focus talaga sa physical therapy. But technically working, I let them work at 3 weeks to 4 weeks kasi I know that they've been doing the work, the therapy, and they are already very good. When they go to the clinic for the follow-ups, they're already walking very, very nicely. And if I see any limp, I focus on regaining their normal walk po. And of course, they can go back to work. So 3 months siguro is a little too long. So yeah, hope that answers your question po, Sir Belma. And let's check the chat sa mga tanong. Doc, if may insurance, enough na po ba yung 250k ang limit? It's really tricky because sometimes yung insurance will not give you the full 250k. Sometimes they will only give you, even if you have 250k, they will give you only 150 to 200. But usually the 200 is enough for an outpatient ACL reconstruction po, Sir Donnie from the chat group. So best po na, again, you talk to your surgeon, get an LOA or letter of authorization for your insurance to check kung ilan yung ika-cover or magkano yung ika-cover po sa insurance. Because just because you have a 300,000 insurance doesn't mean the insurance will give you the full 300,000 po. So I hope that helps. And yeah, asa dapita sa Cebu kayo, sir. So clinic is at 401 Robinson Cybergate. It's in Fuente Osmeña, just across Chongwa Hospital po. So, yeah. I think wala nang tanong. Have a great evening, everyone. So, I think there's no more questions from the chat group. Again, we'll do a live every 2 weeks siguro to answer all the questions from the chat. And I hope to see you soon po. Have a great evening. Happy Sunday, guys. Mga katuhod, good night.